Good afternoon, everyone, or good morning, depending on where in the world you're joining us from. I'm Sara Pantuliano, I'm ODI's Chief Executive, and it's my great honor to welcome you all to our conference on inequality and the social contract in partnership with the Government of Ireland. Before I introduce our distinguished keynote speaker, let me first set the scene. We are meeting today in a year like no other. The world has faced and continues to face exceptional challenges. And yes, challenges in the delivery of healthcare, but also in the provision of other vital services, be that education or employment support. If anything, COVID-19 has laid bare, it has accentuated the frailties, the fault lines in the political and economic systems. It's actually exposed the serious challenges in the social contract in a way that's been brewing for many years in the context of widening inequalities within countries and between countries since at least the 2008 financial crisis. I don't think that the full impact, the full economic and social impact of COVID-19 is yet clear and probably won't be for some time to come. But we definitely know that it will have a lasting impact on the four corners of the world. Regardless of the pandemic, global inequality, the gap between the poorest and the wealthiest in society, had actually been rising for many years. And 2020 was no different in that respect. In fact, we've seen the wealth of the world billionaires continue to increase. Case in point being Jeff Bezos making even more money off the back of national lockdowns. But whilst Amazon's share price continued to rise, we have seen global poverty for the first time in 20 years, rising with an estimated 115 million more people being plunged into extreme poverty. And those who have suffered the most, those who have been most exposed to the health, to the economic, to the political fallout of the crisis, are actually those who were already farther behind. Are those who were farther behind because of a set of multiple and intersecting identity-related inequalities, be that gender, age, race, class, and amongst many others. No matter where in the world you were, COVID-19 has had a disproportionate impact on young people, on women, on people from Black and minority backgrounds, people who the education system had left behind, and people on low incomes. And because of the inequalities compounded by COVID-19, have had a particular impact on the social contract, have eroded the social contract. This has had a knock-on effect on governance systems, particularly on democratic ones, as we can all witness from the extraordinary events of the past few days. Political polarization has become more marked. And this is a real problem because polarization means it's going to be difficult to achieve the kind of political consensus that is vital to promote a more inclusive, more redistributive social policies. In many ways, 2020 was a year many people would rather forget, but it was an important year for ODI. We marked our 60th anniversary. We looked back at 60 years of conducting research and providing advice to address some of the world's most intractable problems. And rising inequality, despite years of work and impressive gains actually in poverty reduction, for us remains at the top of the list, as it does for many working on global affairs and international cooperation. We launched a Global Reset Dialogue in July, which called for a different economic framework, an economic framework that moves beyond a sole focus in efficient markets and actually looks at new macroeconomics that must encompass a broader definition of stability, one that is compatible with sustainable human development. But to achieve that, it will require some robust analysis of power, first and foremost, and the political economy questions that can help us identify the obstacles to progress and the pathways to overcome them. So today, we'll explore three central themes to try and address this call for change. First, we'll take a look at the evidence on the inequalities that have been exposed by the crisis, the kind of things that we've seen dominate the headlines over the last 9 months. Then we will ask ourselves what challenges and opportunities have emerged in the broader political economy that can help us change fiscal policy on the back of the pandemic. And then we'll finish by trying to chart a vision for a new social contract at the center of the global reset. But before we get to that, I would like to deeply thank our partners at Irish Aid, the government of Ireland for making this conference possible. And I'm tremendously honoured that Minister Simon Coveney, Ireland's Minister of Foreign Affairs, is here with us to open this conference. Under Minister Coveney's leadership, Ireland has been at the forefront of global efforts to end extreme poverty by targeting the farthest behind first. And like Ireland, ODI is committed to achieve a more sustainable, peaceful, and equal world. And we believe, like our partners in Ireland, that a primary way to do this is to address existing and persistent inequalities. Before I hand over to Mr. Coveney, just 30 seconds of housekeeping rules for you. So many of you joining us today are experts in inequality and social protection issues. So we encourage all of you to really share reflections and questions via our interactive Google Jamboard. A link to that has been posted in the chat right now. We have links that can be found to the conference in the conference webpage, but if you get lost, our digital shepherds will help direct you, and their links are now in the chat as well. You can post questions in the chat box, but please also use the Q&A box to interact with the panelists. Again, the digital shepherds will keep an eye on the questions and put them to the panel. And finally, please engage on Twitter. Make sure that what we're discussing today gets more widely shared out there. The hashtags we're going to use today are ODI60 and inequality. They've been posted in the chat right now, and some Twitter handles for you to also keep in mind. But now, it is my absolute pleasure to give the floor to our distinguished first speaker, Minister Simon Coveney. You can hear directly from him about Ireland's commitment to ending inequality. Mr. Coveney, it's a real pleasure to have you with us.
Thank you very much, Sarah. Ladies and gentlemen, it's a real pleasure to be here with you today at this important conference and focusing on a theme that I think is going to, I hope, dominate global politics for the next 12 to 18 months, which is how do we approach a global reset in terms of learning lessons from this pandemic, which has been so tragic and so destructive and continues to be. In fact, it's more powerful now than at any point since it began. Although many countries are perhaps experiencing really tough times, including my own, but nothing in comparison to what some developing countries are facing. It is important too that we try to look to a world beyond the pandemic and start planning for that and thinking about that. I'd like to thank Sarah and the Overseas Development Institute team for organising this event, which gives us a space to explore what comes next. And of course, to mark ODI's 60th anniversary, which Sarah has already mentioned. For much of those 60 years, my department has worked very closely with ODI research, helping us in our policy development. I think that we have all seen over the past year the importance of rigorous evidence and analysis-based decision-making. Unfortunately, we've had too much political decision-making that is not based on evidence, and we've seen the consequences that flows from that. The virus has reminded us too that complex issues do not lend themselves to simplistic solutions. Knowledge and evidence evolve, and policy responses must be dynamic in the face of that evolution. And believe me, we are learning that in Ireland. 3 or 4 weeks ago, we had the lowest COVID numbers in the European Union, along with Finland. Today, COVID is growing at a faster pace in Ireland than any other country in the European Union. It's amazing how things can change. And indeed, evidence requires a different kind of response as things evolve. That's why I put a great store in conferences such as this, where experts and practitioners gather, test their knowledge against evidence, and hopefully bring their collective wisdom to bear on optimizing policy responses. It's important that we work towards a meaningful and inclusive global recovery from this pandemic. I don't underestimate the complexity of that task. Against the backdrop of economic challenges, multipolar power politics, and increasing humanitarian need all the time. The understandings that come from today's discussion of the relationship between COVID-19 and inequality will help map, I hope, the way through those complexities and help illuminate where opportunities will come as the world attempts to reset following this pandemic, with a greater emphasis on those furthest behind. This year has seen a change in how we work, how we travel, particularly in developing countries. That's given the climate, to a certain extent, a break, but an insufficient one, as melting ice caps will remind us. It is essential that we build back greener. I have to say I'm not that fond of this build back better, build back greener type of language, but you know what I mean. But in doing that, we must be fair to countries in development who have done least to contribute to the climate crisis. In Ireland, as in many other parts of the world, we have once again entered into a period of enhanced restrictions in an attempt to limit the spread of the virus. This is the right thing to do in order to protect the health of those most vulnerable. Yet we are cognizant of the need to safeguard their livelihoods and other aspects of their well-being too. It's not simply a case of restrictions alone. As the discussion today will address, the pandemic provides an opportunity to address the explicit needs of those countries and people with specific vulnerabilities. For example, prior to the pandemic, many low-income countries already had weak health and social protection systems. Many countries were struggling to manage high debt burdens. The health impacts of COVID-19 will have particular impacts on communities experiencing humanitarian crises, those hosting large numbers of refugees and people working in informal and precarious employment, as so many millions of people are. There's also an important gender dimension. Disease outbreaks affect women and men differently, and pandemics can exacerbate existing gender inequalities. Women face more risk at the front line, are shouldering a greater burden of unpaid care work, and are suffering a significant increase in gender-based violence as a result of lockdowns. And yet, as we navigate the challenges it throws at us, at all levels of society, we are looking to women's leadership. We know that social protection is and will continue to be a vital tool. In Ireland, we've implemented large-scale social protection measures in response to the pandemic, but we can afford to do it. Many other countries can't. And through our international development program, we are supporting social transfers that reach those most in need where possible. To be effective, efforts to build back better must be fully cognizant of the unequal effects of the pandemic across society and between men and women. We must ensure that those inequalities are not further entrenched in a post-COVID policy response. Indeed, the COVID-19 pandemic provides us with an opportunity to rethink the poverty and inequality challenge in general, how we characterize the problem, and what solutions we identify. I can tell you, low-paid workers in the health system in Ireland are valued in a very different way now to the way in which they were valued by the public 12 months ago. As we see the re-emergence of debt as a development challenge, the escalation of fragility in many middle-income countries, and the existential threat posed by climate change, it is time to reevaluate our role as traditional donors too. The emergence of new vested interests and non-traditional donors, as well as the dramatic change to the context, mean we must take stock of where and how we affect change, and how we bring others along with us in doing so, if it's going to be meaningful. We also need to push for a more effective rules-based international order. Here, multilateralism plays a critical role. Now is not the time for isolationism, or as some have described it, some people who should know better from very powerful countries have described it, transactional-based bilateralism. In other words, choosing whether countries are with you or against you. That kind of approach to international politics and international development simply doesn't work. It divides people, it divides political leaders, and it results in the most vulnerable people remaining vulnerable. As the WHO's Dr. Mike Ryan has continually reminded us, no one is safe until everyone is safe in the context of this pandemic. The pandemic has brought into sharp focus our interdependency on each other and the importance of collective action to address global challenges. No one country is powerful enough to do this on their own, And no one country is even powerful enough to protect their own citizens on their own when it comes to a global pandemic. The multilateral system, if harnessed effectively, can help hold our focus on those furthest behind. Working together can help us navigate the multiple complexities that exist before the virus and which have been exacerbated by its remedies. Ireland is proud to be playing a part in this respect, and it is only a small part, but it's one that we take seriously. To date, we've provided almost 150 million euros to the global response to COVID-19. We are also proud to play our part in the EU's response, including partaking through the EU in the COVAX facility. This aims to ensure equitable access to vaccines that have emerged. And that's going to continue, I think, to be a significant global pressure point as the year moves on. When agreement on the Sustainable Development Goals was achieved in 2015, a process led, I'm proud to say, by David Donoghue, then Ireland's permanent representative to the UN, and now, of course, a distinguished fellow of ODI. We could not have imagined the risk we face today, that hard-won development gains would be going into reverse in many cases. The pandemic is asking all countries, communities, and businesses to re-examine their operating models and consider a different way of working in the future. We must see this as an opportunity for renewal and look to the future with optimism. I know that today you'll be looking to the future and what policymakers can do to support an inclusive recovery. I look forward to hearing your deliberations, and I, for one, will look to advocate for policymakers and senior politicians to have an open mind on the basis of evidence and fact-based policy formation. Of course, I want to thank ODI again for their work, and I want to wish you well in your discussions today. And I'm delighted to be able to stay for a little bit longer, and hopefully we'll be able to take some of your questions if that's helpful. Thanks very much.
Thank you so much, Mr. Coveney. Well, first of all, for your generous words on ODI, but more importantly, for such an excellent framing for today, and actually for Ireland's leadership in continuing to champion the importance to tackle inequality, globally, to really try and chart a different path for the future in these recovery efforts. Like you, I'm not a great fan of Build Back Better because I think it can hide the complexity of the recovery. But yeah, let's try and use the discussion today to think how we can make this rebuilding fairer and more sustainable. And with that, I'm grateful that you can stay a bit longer. I'll hand over to my colleague, Francesca Bastaglio, who is the director of our Equity and Social Policy team, who will lead the first panel and engage with you in further discussion. Francesca, over to you.
Thank you, Sara. So welcome, everyone, to this first panel of today's conference, which is entitled Inequality Exposed. As Sara has already said, my name is Francesca Bastagli. I head the Equity and Social Policy program at ODI, and I have the honor of chairing today's opening panel. As the Minister Coveney and Sara have already remarked, we know that COVID has exposed inequalities and policy gaps, most of which I suspect many of us online today were well aware of. We've been analyzing and working on these issues either as students, researchers, policy practitioners over many years. One of the things that has changed since the onset of the crisis almost a year ago now in some countries is that these inequalities have become more visible to society. They've been making headlines and they've come to the forefront of policy debates, both domestically and in international arenas. In addition to exposing the inequalities, the crisis risks exacerbating them, as again our previous two speakers have already remarked. And this is one of the questions we're looking at in this session. Far from being an equalizer, as the pandemic was initially described by some commentators, there's a growing body of evidence that shows that its adverse impacts vary across population groups, vary by age, gender, race, and risks. The crisis risks exacerbating or entrenching what are deep-rooted inequalities. At the heart of these unequal impacts are existing inequities and gaps or shortcomings in policy. And this is one of the main focuses of the conference today. We want to understand what these gaps and limitations are, and in order to identify what the priorities need to be moving forwards for governments and partners if things are to be different, if we do want to work towards a global reset and a new normal, to use another phrase that is probably not ideal, but gives the picture. In the second session, we'll be focusing specifically on social protection and taxation, so and wider fiscal policy, what the opportunities and priorities are there. The third session will look at the social contract and what that needs to look like. This particular plenary will look at two broad sets of questions. One is, what do we know about whether and how the crisis is impacting inequalities across a range of dimensions, so income in the world of work, education, health. As we say, there's a real concern that despite the crisis highlighting these inequalities and the shortcomings of existing policy, and despite their rise up the policy agenda, that we do move towards a world with greater inequalities if we do not do something and if we do not act fast. And related to that, the second set of questions is on policy specifically. Given the policy gaps or features that have enabled this differential and unequal unfolding of the crisis on different population groups and countries, what are the policy priorities we need to be mindful of, both in the immediate or crisis response mode, but also moving into the recovery phase. We know that crises can indeed present opportunities for change. If so, what are these opportunities in this context, and how do we make sure we harness them as we move forward towards a more equal society? So these are the minor questions we'll be tackling in the session in the remaining 40 minutes or so. It's a true pleasure for me to welcome our four distinguished speakers. Here with us today, we have Chico Ferreira, who is Amartya Sen Professor of Inequality Studies at the London School of Economics. He's also director of the LSE's International Inequalities Institute. Lisbeth Stier, director of the Education Commission. Els Torelle, visiting policy fellow at the Institute for Innovation and Public Purpose at the University College London. And Paromita Sen, research manager at the Self-Employed Women's Association, SEWA. We also, as Minister Coveney mentioned, he will also be staying on for at least part of this panel. So I encourage the panelists to, as they come to their responses to the questions we'll be asking, that they include any further questions or comments to the minister's remarks. We will be, the speakers will be providing an initial 4-minute brief commentary to the question of the evidence of the impact of the crisis on inequality. We will then be leaving a few minutes for further remarks by the minister, and then opening up the session to Q&A for the audience. So please, by all means, submit your questions in through the chat box. And then just a final point, we will then be breaking out into breakout sessions, one on education, health, and income and wealth. And I encourage participants, please, to join one of these sessions to continue the conversation on these topics. But first, turning to Chico. Chico Ferreira, could you tell us, based on your work and a wider review of the growing evidence on the impact of the crisis on inequality, what are we seeing? What is the impact?
Okay, thanks, Francesca, for the invitation, and happy birthday to the ODI on its 60th anniversary. So in 4 minutes, I'll be very quick. I've 4 points, one per minute. The first one is, our prior for almost everyone going into this pandemic was that it was going to be inequality increasing, and that's because of two main mechanisms that I want to highlight. One, in the labor markets, is that a new inequality was created or became hugely important, which is our inequality in the ability to work remotely. in the ability to do one's work from home or far away from others. That ability turns out to be highly correlated with education and therefore with pre-pandemic income. And so it exacerbates, as people have already said, pre-existing inequalities. It tends to be the case, with nuances, but it tends to be the case that richer, more educated people are able to keep their jobs much more than poorer people and people in informal sector jobs in the developing world who need to work out in the streets or in contact with other people. So that's a key mechanism on the labor market. There's an additional mechanism in the capital market, which is more or less as follows. Central banks respond to the major recession with a big injection of liquidity. And that liquidity in a depressed economy did not lead to higher prices of goods and services, but did lead to asset price inflation. Rises in the values of bonds and shares and stocks and other kinds of property, and of course that benefited richer people. So as Sarah already said in her introduction, the billionaires' wealth has gone up in most major economies in the world. Some of that is technology, but a lot of that is just this global liquidity being channeled into higher asset prices. So on the labor market on one side and on the capital market on the other, big reasons for inequality to increase. My point number two is, okay, that's the theory, those are the mechanisms. What did we see in the evidence? And here I want to ask you all to be cautious. Okay, the evidence is actually mixed. This pandemic is still happening. A lot of the data is not yet in. And the data that is in is mixed in the following way. We do see evidence of rising inequality along these two mechanisms that I mentioned in a number of countries, including the US and some Latin American countries like Argentina and Colombia, Mexico, for which there is tentative early evidence of increases. In the US, there's work by Raj Chetty showing that employment did behave as we expected. Employment fell more amongst people with lower wages and least amongst people with higher wages. So the mechanisms are there and that's happening. Yet there is some work out there showing that inequality has appeared to have fallen in places like Brazil. And just over the last few days, a new paper by people at the Paris School of Economics and the University of Luxembourg arguing that inequality in income may have fallen in 5 European countries: Germany, France, Italy, Spain, and Sweden. How is that possible? Well, in those cases, in all those 6 cases, including in Brazil, it was due to policy responses. It was due to the fact that well-targeted cash transfers and social protection did reach poor people. And actually, in these cases, it did enough to actually cause inequality to fall. So the crisis itself leads to an increase in inequality in primary incomes, but policies can work and can make a difference. And when we just look at inequality at the end of the day, the answer will not be the same in all countries. So I do ask all of you who work in policy and politics to bear in mind a little bit the nuance. Within country income inequality, the picture will not be the same in every country at the end. But it is because of policy responses. Okay. Now, my point number 4 is that there's one area in which there is no need for nuance, and that is poverty. Because the pandemic increases inequality, but also lowers just aggregate income, lowers the mean of the distribution, poverty has, as Sarah said, gone up almost everywhere, including in richer countries. And it has certainly gone up in poor countries. The latest numbers I have are around 120 to 140 million people added to the count of the global extreme poor. That's a major reversal. The trend was for a big decline in poverty over the last decades. And this sets us back 5 to 6 years at least. It makes it basically impossible that the world will meet the Sustainable Development Goal number 1 of eradicating poverty, or even of getting it to 3%, as the World Bank says, by 2030. So the pandemic in that sense has been a major disaster. Okay. So policies matter. Poverty has gone up dramatically, huge costs on well-being. My 4th point, final, as I'm running out of time, is that this picture is just a picture right now of income inequality and poverty. Going forward, Some of the inequalities that I think my panelists will discuss, my co-panelists will discuss, inequalities in health, in the pandemic itself, in mortality due to the pandemic, which has been massively unequal and not been an equalizer at all. Inequalities in education arising from the major disruption to the education system and school closures. Those things are going to lead not only to inequalities that matter in themselves, but to persistent and perhaps growing inequalities in income and wealth in the future. So what we're seeing now is the short term, and that's the evidence I've discussed. But I think these inequalities my fellow panelists will talk about are perhaps more important in the long run. So I'll leave it there. Thanks very much.
Thank you, Chico. And that leads on very well, Lisbeth, to you to talk about the evidence on the impact of the crisis on education inequalities.
Great, thank you so much, and thank you to the previous speakers for this incredibly useful framing. I maybe will stick with Chico with the 4 points and try and do it in 4 minutes. So in education, the situation is as follows. First of all, we are seeing setbacks in learning because of the pandemic, and education has actually not been a sector that necessarily has been as much in the news as health and job losses, although increasingly people are very worried, and we are all affected by this because our own children are not able to go to school. So the setbacks in learning are due to a number of things. First of all, there have been the widespread school closures around the world, which at some point affected 1.6 billion children around the world. Estimates suggest that this will likely lead to an increase of 10% of children who are in learning poverty, which means that they can't read at the age of 10. That brings the total of children in learning poverty in low and middle income countries to 63% from around 53% before. The extra 10%, initial estimates show that about 80% of these losses will be concentrated in the bottom quintile. So it will affect the poorest countries and also the poorest people, because it's not just in poor countries that we have learning poor. In fact, the largest number of learning poor are in lower middle income countries. The other driver of this setback is the access to technology. Chico was mentioning how that affects the labor market, but it also affects people's access to schooling. We have seen that 31% of school children are not being reached by any kind of remote or digital program. It's obviously much, much higher in low-income countries, more than half. But again, 70% of the children that are unreached live in rural areas or come from poor households. So again, they are being set back. And then the other point, so the setback in learning is one. The second point is the wider issues that emerge from not being into school, which have to do with, for example, access to nutrition. We know that more than 370 million children have not been able to access school meals. And that is in many cases for vulnerable children, their only source of nourishment. So the setback is also going to come later on when children who will have been malnourished with the impacts on their health and their brain function potentially will be less able to learn. Again, that impacts the poorest more than the richer. The third point is around money. We worry quite a bit that the budget cuts are going to be problematic for education for a number of reasons. First of all, previous financial crises have shown that cutbacks often affect the education sector for a number of reasons. This could potentially be particularly problematic in a number of countries which are in the lower middle income country bracket. Interestingly, those countries have a harder time to keep up their spending. And there is a lot of analysis ongoing right now how actually different income brackets of countries are being affected by the spending cuts. initial data shows from previous crises that lower middle income countries are being particularly affected here. And that also will translate into cutbacks in spending on education. The second thing is that household spending is going to be affected. And this is in low-income countries a big source of spending on education. The poorer the countries, the larger the share they spend on education. And so what Chico was saying about sort of income levels is going to have an impact on education. So with all of this, I actually want to think about what we can do and what the world can do to try and mitigate this and make sure that the poor are not as much affected by this. I think the message that the minister was giving around multilateralism and coming together is true more than ever, and we need it desperately. We cannot operate the way we have before, and that is a big message that we as the Education Commission have been trying to convey for a number of years. We have convened a number of organizations, big multilateral organizations, in a Save Our Future initiative around education. And based on evidence, another point that was highlighted earlier, we came up with an action plan for the response. And I'll just say very quickly 3 points of that action plan. One is the return to school must relentlessly focus on those left behind, because otherwise people may not even return to school, let alone if they return, they will be behind. So cash transfers, school feeding, incentives are important. Action number 2, we need to relentlessly focus on foundational learning. The foundations need to be put in place, because those children, the poorest children, are typically the ones that don't even have the foundations. Remember the learning poor, 63%, we need to address that. So focus on foundations and do that in a much more adaptive way. And there's a lot of literature on how to do this well. And finally, on finance, country recovery packages for the pandemic need to include education. Right now, we're hearing a lot about climate, we're hearing a lot about health. What is happening with spending on education? Typically, in recovery packages, education hasn't been a big priority. Similarly, when we look at the donor spending, we need to protect education. It's fundamental to anything. The climate problems, the economic problems, we can only solve them if we invest in education. In this, donors need to be working much more multilateral, but also be more innovative. And I would highlight the opportunity here of the International Financing Facility for Education, which is trying to make sure that $1 spent by a donor is multiplied. We need to look at ways to multiply donor dollars, because there's going to be fewer of them. So a call for multilateral approaches and looking for multiplication in spending as well, obviously, as efficiency. Thank you very much.
Thank you, Lisbeth. Els, we turn to you for points on the evidence of the impact on inequalities in health.
Yes, thank you so much for the opportunity to present a few points. And I mean, given that the COVID pandemic is in the first place a health crisis, there's no surprise that, and it's also been well documented, how COVID has actually exposed and exacerbated existing inequalities in health. And I think mostly, as was already mentioned, the most vulnerable in general have been most affected in terms of mortality, morbidity, and the most vulnerable, also highlighting all the well-known social and economic determinants of health. But I want to spend my very little time that I have to focus on one other aspect that have become very flagrant. That is the inequality that exists and that is being exacerbated and exposed again around access to health innovation. And we've seen it, we are seeing it around diagnostics, around treatments, but in particular around vaccines. This has now become a really flagrant problem. And so obviously we had the new virus. There has been an enormous and a massive, impressive mobilization of medical research and development, impulsed by massive funding, financing, in particular from many public sectors. Many country governments have invested, companies have invested a little bit, but they are vaccine companies were not so keen on investing, but with all that government support, they have massively invested. And we now, in a record time, after a year, we have multiple vaccines that become available. However, the access to them is highly unequal. And just to highlight a few figures, it's been estimated that some of the wealthy countries representing 13% of the world population have already hoarded the vaccine supply of more than 50% of the vaccine supply that we're expecting to have in 2020. And it's continuing like that, or it's getting worse and worse. I was reading that, for instance, in Africa, 55 countries, 21 of them have access or no, have been able to purchase a few doses of vaccines. The majority have zero access to vaccines for the time being, and not a prospect to even having much vaccine coming through in 2021, even 2022 is a question. And so the two main aspects to that is that, at one hand, despite all that public investment, we are working within a system that has commercialized, basically, and has let the initiative for medical R&D, or the ownership more precisely, in the hands of the private sector. And so we are confronted now with monopolies. A few actors, a few companies control both the data, the knowledge, the manufacturing, and the access and the pricing of these very critical public health tools, because vaccines, more than anything else, are actually not just good for the individual, but also for the collective. They're collective tools, and vaccination only works well if you can implement it collectively. But the tools for that, we have left them in the hands of private companies. And secondly, we have the governments who, despite initial declarations for having the vaccines to become a people's vaccine, vaccines need to be equally and equitably available and affordable and accessible everywhere. Despite this political declaration, remember, the people's vaccine is a term that is being used, common goods, global public goods, etc. Despite all of that, they have been hoarding and buying the majority of the supplies, some of the wealthy countries, leaving the others actually without vaccine. And so this is a structural inequality that already existed. The lack of R&D governance in the public interest, that it is actually mostly in the hands of a few private actors, collaborated with a few wealthy governments, and we see now that leads to a massive inequality in terms of access to the vaccine. And so I think we have solutions for that, because there has been an active movement for access to medical technologies for many years to promote that in developing countries. The first thing is about sharing of the knowledge and the intellectual property rights, creating massively available manufacturing capabilities. We can do it, but we need the political will to do that. And I think, and I hope that can be part of a new social contract where vaccines are not ordinary market commodities, but actually global health commons, global public goods. I'll leave it here. Thank you.
Thank you very much, Els. Mr. Coveney, Minister Coveney, I'm mindful you had a bit of time, but not much longer. Are you able to listen to Paromita's intervention, or would you like to come in now? Do you have 10 more minutes?
No, I'll certainly listen to the next intervention, and I'd like to make a few comments if I could then maybe, I'll probably have to slip away at that point, but there's some interesting comments to be made by panelists, which I think might be interesting to give a political perspective on.
Yep. Yes, thank you. Thanks so much. So Paromita, over to you, and the challenges and possible also opportunities that are presented to, particularly to women working in the informal economy.
Yes. Hi. So I'll be talking a little bit on women and work, especially in the informal economy. As we know, women, the informal economy, the ILO, I think last year predicted that 400 million women, 400 million workers in the informal economy would be falling further into poverty. In South Asia, this becomes a really compounding problem, right? Because 94% of the female labor force in South Asia are employed in the informal sector. I mean, that's basically like the entire labor force, I think, other than people who look like me. In this space, when we talk about the informal sector, there are a couple of other things that we need to keep in mind, right? The sector itself, even though it's like 95% of the workforce in India, each trade within this sector is impacted very differentially. So a domestic worker, for instance, faces risks at the workplace, right? Because a workplace is somebody else's home, as well as harassment and further stigmatization. She still is able to work, but is facing a lot of stigmatization as being the virus carrier, even though we know that the virus was brought about by people who could access international travel. A street vendor, on the other hand, faces an entirely absent workplace. The workplace itself doesn't exist for her. Agricultural workers is where you really start seeing the intersection, for instance, of the informal sector and then patriarchy creating compounding problems when we talk about the impact of the COVID-19 pandemic. So agricultural workers were allowed to work even when we were in like very severe lockdown for 3 months. However, women agricultural workers don't have access to transportation because of the way patriarchal norms around transportation and asset use work in this country. So agricultural workers, while the men were able to take their produce to larger markets and sell at competitive rates, women were forced to take it to the absolutely local market and sell at losses, or basically survive on subsistence farming. Other places where we've seen that the informal sector and patriarchy intersecting is the lack of documentation for both the worker status as well as therefore social security status. So when we talk about lack of documentation, this is why I'm listening to Professor Sisko, right, about how policy responsiveness can really help target and help vulnerable populations. The challenges around that is that women aren't even recognized as workers in large parts of the world, right? Domestic workers and home-based workers, we've had to take this all the way to the ILO to get them recognized as workers. Hasn't always been successful at the national level. So when it comes to recognize, if you aren't able to recognize them as a worker, you can't recognize their rights as a worker and therefore their access to social security. In areas where we do have recognition, so for instance, the construction workers in India, they are recognized and there's a welfare board. Men are more likely to get that recognition as workers and therefore have access to any form of social security, any form of targeted social protection that was released, especially during COVID. Other things that we've noticed is, again, like the general condition, right? So COVID just really highlighted pre-existing inequalities and worsened them, which is something that's a trend that all the panelists have mentioned. So for instance, I was thinking about assets, right? Property is always in the name of the man in large parts of the world. This is consequences, right? So women, agricultural workers, again, aren't recognized as agricultural workers because they don't own land. Additionally, when it comes to assets that are being sold off, research has been done that anytime there's a recession or a economic crisis of any sort, women's assets are the ones that are sold first. That remains true even during this pandemic, right? So cell phones were the one, right in the first few months, we noticed that cell phones of the pandemic were the assets that were being sold off really quickly. That affects women and children more than anything else because it was women's cell phones that were being sold off, which then later affected the children who couldn't use cell phones to stay in touch and stay even remotely connected to any form of education. Assets and resources, when we are talking about redistributing them due to, again, the informal sector, lack of documentation and patriarchy, these are being distributed to men first. Again, I don't at any point of time want to say that men in the informal sector aren't having it hard. The migrant crisis, as globally, we've noticed that there's been a very severe migrant crisis, especially in India. However, when these resources are being distributed, women are being left out. So for instance, let's talk about education, right? Like as we start talking about education, eventually resuming in South Asia, girl children are the ones who aren't being able to return, right? If resources have to be split and it comes down to who can return to school, the boy child is going to be favored over the girl child. So any recovery solution that we need to be thinking about needs to be very, very cognizant of this intersectionality, right? So it's not just the fact that you're talking about informality and patriarchy, you're also then talking about further things like rural access, right? Like we're talking about entire states here which don't have access to hospitals. COVID in these cases isn't even the massive health problem, right? It's like very basic problems that we're talking about, such as childbirth and TB. right? These are the areas that we've seen the real rollback in health rights and access to health, and all the work that has been done over the last decade or so. And I mean, SAVE has been working in the space for over 5 decades, right? We are seeing the rollback in areas like maternal health care, right? Because ambulances were being reserved for COVID patients and saved only for COVID patients, which means women like about to give birth were being taken on motorbikes for over 90 kilometers to get to an open hospital that would accept somebody given COVID restrictions, right? TB medication stopped coming in. Any kind of preventive healthcare that has been happening has had to stop. Frontline workers tend to be informal in this space, right? We have this entire cadre of frontline workers called ASHA workers. They're the ones who had to bear the brunt of this, and they're absolutely frontline with no form of medical protection because they're considered volunteers. They're not volunteers that are on honorarium, but they aren't even given the status of workers, thus further contributing to these challenges. This is, of course, like on a backdrop of just larger global political problems that we're seeing. For instance, in some places, we're seeing the rise of conversations around labor laws, and not in the direction that they need to go in. We're seeing the rollback of worker protections to try and get the economy working again, right? So the idea of being like reducing on factory hours, reducing like worker protections when it comes to like the number of hours you work and the access and transportation and other benefits. These are being rolled back, and these are being rolled back in the formal sector, like from the factory floors. Once you take this to the informal sector, if something happens in the formal sector, it happens much worse in the informal sector. 2, because of the gender disparity, if people have to work for much longer hours in the factories, those are the men. That means women are picking up the entire burden again at home. There has been a significant mental health burden as well on women because the stress of the pandemic has fallen on women. And then, of course, as many people have mentioned,
Paramita, sorry, Francesca here. Yes. Sorry, I'm just stepping in because I'm mindful we will be coming back to you if time permitting. Thank you so much.
Yes.
Thank you. There's lots to talk about, and thank you so much for these examples. I do want to come back to the Minister Coveney before he needs to go. Minister, you've heard a lot of the channels through which the crisis is affecting a host of different dimensions and outcomes, some of the evidence on different types of trends, and the role of policy. Your feedback or thoughts?
Yeah, I mean, look, just first of all, in relation to some of the comments that Chico made at the start around the impact on labour markets and increasing inequality and increasing poverty, and there being some mixed evidence in terms of the impact on certain countries around rising inequality, and countries like Germany, France, Spain, Sweden. I suspect it may well be the case in my own country as well. Countries that have very strong social safety nets and can afford to put huge funding into short-term supports to keep income levels intact, despite the fact that that labour opportunities may be absent for a temporary period of time. I think it's not surprising in those kind of circumstances that we haven't seen a significant income inequality developing as a result of the pandemic. The problem is in the medium term, even in wealthy countries like Germany and Ireland and Spain and the UK and so on, the kind of supports that we have been putting in place. I mean, Ireland borrowed 20 billion euros last year in order to respond to the pandemic, to try to keep businesses intact, if not active, for a temporary period of time when restrictions were in place. But that kind of dramatic investment in the short term is not sustainable. And so the real challenge here is, how do we rebuild an economy that allows people to recover employment, to go back to work? At the worst of this crisis, we had unemployment levels in Ireland well above 20%, which is extremely high by European standards, but in many ways a false figure, being temporarily supported by significant social safety nets and income supports that are an emergency response, as opposed to something that can last into the medium term. So the real challenge here is, how do we ensure that even in developed, wealthy economies, do we reshape economies post-COVID in a way that can allow a rising of all boats, if you like, with that tide of economic growth. And a lot of evidence would suggest that that will be a lot easier said than done. It is true to say that richer people generally tend to have the capacity to insulate themselves a lot more. And the evidence of that in my country is that income tax in Ireland, you would have expected would have collapsed over the last 9 months, when at times we hit 20% unemployment. But that actually didn't happen. There was relatively modest falls in income tax in low single figures, actually, in percentage terms. And that is because people who are middle income earning and higher income earning, by and large, held on to their jobs, and people who lost their jobs in the short term were lower income people who weren't paying tax or paying very, very little income tax. And again, I think that reinforces the point that Chico makes around the impact that this has had on, for example, public sector workers that have been able to work from home have had really no impact on their salary levels whatsoever. But it's been private sector low income employment primarily that's been hit hard by this, and how we rebuild that sector in a more resilient way in the future, I think, is a big challenge. And that's speaking from a developed country that has had huge resources to spend. The challenge, obviously, in lower income countries is a much more raw one, because that safety net doesn't exist in the first place. Just the comment on education, Elizabeth's comments, I think are so true. I mean, our development strategy is very much centered around education, and the education of girls in particular. And I think that's going to be more important now than ever before. And what we're trying to do, I mean, Ireland spends about 850 million euros on development funding each year. None of it tied, I'm glad to say, to any other commercial interests. But we are reevaluating how we spend that money now in the context of the pandemic. I must say I'd be very interested to read that action plan from the Education Commission to see how that might impact on the hundreds of millions of euros that we commit to education each year in other parts of the world, and how we could focus that in a more targeted way to help to get vulnerable young children, particularly young girls, back to school as quickly as possible. Just one comment in relation to the vaccine issue, because you are right. There's been plenty of speeches made by world leaders around the need to be generous to ensure that when vaccines are available, that they become available for everybody on the basis of need rather than wealth. And certainly when you look at the stats now, that isn't how it's developing. But I'm not sure that this is a private versus public sector issue in terms of solving the problem. The truth is that it is politicians who are driving and who are being driven to prioritize their own people first. Because in many ways, that is the nature of politics and public demand in individual countries that are desperate to try to find a way through this pandemic and out the other side. And so by simply shifting from a private sector control of innovation, data, and ultimately product to sell towards a public sector system of producing those vaccines doesn't in itself solve the problem. Because in many ways, people in the public sector are under as much pressure to deliver for their own countries as indeed private sector companies are to actually sell to countries that can afford to buy. So instead, I think what's needed, I also think, by the way, the pace of delivery here may not have been possible in terms of public sector delivery. Maybe I'm wrong on that. I wish I was, but I think the combination of public sector money and private sector innovation has delivered vaccines way ahead of what many people predicted possible. The challenge now is, how do we actually deal with the politics of this as well as the financing of it to ensure that parts of the world that have weak health systems, that are already under massive pressure and are more exposed to COVID than those of us in the European Union and in other wealthy parts of the world, despite the fact that we're desperate for vaccine rollout. But I know the pressures I'm under every day in terms of being questioned around why isn't the vaccine being rolled out faster in my country, despite the fact that we're one of only 40 countries in the world that have any vaccine availability at all. And we're probably in the top 5 now in terms of pace of vaccine rollout in the European Union, but it's still too slow. And we're still under huge pressure politically to source more vaccine and roll it out faster. So the politics of that doesn't get solved by a shift from private to public in terms of control. And I think it's important to recognize that. That being said, the point that Elizabeth makes is spot on. The wealthiest parts of the world are now ensuring that they are provided with vaccines first. Although I think there are some exceptions to that, and the European Union is putting billions of euros into trying to ensure that other parts of the world that can't afford to compete are actually accessing vaccines. But I mean, let's be honest, not at the pace of rollout within the European Union, and it's the same in the United States. It's the same in the UK, and I suspect it's the same in many of the countries that that speakers are representing on this call. So I don't have simple answers to that, but I do think in the short term, what we need to try to do here is build political pressure in multilateral fora, like in the UN, in particular in the UN, but also in the EU, and other multilateral and regional structures, to try to actually drive vaccine availability into regions that have the weakest health systems, and to actually help to fund that with a sense of urgency. But I mean, I take the point. Vaccines can't simply be a global commodity, and we've got to learn that lesson from this pandemic. But this isn't just about learning lessons and waiting for the next crisis. We are far from solving the current one, and so there is a need for prioritization immediately in terms of making vaccines available to countries that are being torn apart by this pandemic at the moment. Look, the final point I'd make is, I do agree. Obviously, I bow to the experience of the final panelists there in the context of India and the massive informal economy that is part of so much of the world in terms of how economies actually function in reality. And if you're part of an informal economy, if you don't have structured social protection linked to that employment, well, then when a crisis like this pandemic hits, you're effectively not on the books of the state in terms of supports and access to everything from healthcare to other financial supports, and that is obviously a huge problem exposed by this pandemic, but something that was very much in existence before the pandemic arrived at all, and I think needs to be part of development policy in the future. How do you move huge sections of economies that are essentially informal economies without structure, but rely on relationships? How do you create structure around those so that when crises do develop, there is a social safety net that can kick in by right for people in vulnerable situations, as opposed to waiting for charity, which is the case in many cases. So just some comments, and thanks for the opportunity to come back in.
Thank you, Minister. Thank you for staying on and for the inputs and the comments. We do have really just a few minutes left. I'm mindful that Else in particular needs to step out. So could I ask each speaker, and I'll come to you in turn, starting with Else, to give a final closing remark, either reflecting on some of the words we just heard from the Minister, or just a sort of final key message.
Yes, thank you very, very quickly, because I indeed have to go. Just to clarify my proposal for the Minister, it's not about shifting from private to public, it's to open it up. I think what we have now is monopolies that stand in the way for massive scale up of production by anyone who wants to do it, public, private sector in any country. And this is where governments that are currently in control, Western governments who stand with the private sector model for pharmaceutical production, are also standing in the way. And so it's both of you that need to kind of let go of these monopolies, because these are global public goods that need to be available for everybody. That's kind of the tenor of my suggestion. And I'm sorry, I really need to go, but I hope that we can have a continuation of these conversations.
Thank you. Lisbeth, any final closing remarks from you?
I think a lot has been said, and a lot of very good things. I would say follow the evidence. Let's work together, because nothing can be done just on our own. And I say invest in education, because the structural changes that we're all talking about, this reset, what does that mean? It means that we're going to be doing different jobs, different things. We can only do that if people are educated. Education is the only thing that people can carry with them when all else breaks down. So my plea is, let's prioritize education as a solution to all of these problems we've been discussing.
Thank you, Lisbeth. Paramita, over to you for one final, very short closing remark.
Yeah, I think this is something that builds on what the minister said, but the idea of like building public and civil society partnerships is one of the things that we've seen. Even where there is will, the challenge over here is just to be able to reach the last mile is where we're finding some of those challenges. So the idea of like building up collectives and groups at that last mile and allowing civil society a little bit more stake in the picture is where we've seen any success that we have is building up that local community power and allowing them to make those decisions.
Thank you. And the final word to Chico.
Thank you. No, I just very quickly to echo two things that other people said on the theme of policy. So one is to say that indeed, when I said that where policy worked in terms of cash transfers and so on is where there was capacity to do that, as the minister has highlighted, both financial capacity and logistical and know-how capacity. And so, as Paramita has highlighted, some of the poorest people in the world, some of the poorest women in India, but also in other places in Africa, are exactly the people who did not receive those and who've suffered a great deal from the pandemic. So we should never forget that. And finally, to echo what the minister said, I think he's absolutely right to say that even where there were these successes in terms of policy response, we have to worry about the sustainability and the sort of the next stage and how to maintain and evolve that protection. So he's absolutely right about that. And I think that's a challenge for the rest of the conference to discuss as well. Thank you very much.
Thank you. Thank you to all the panelists. Thank you so much. Lots of food for thought and lots of points to take up. And we will indeed continue this conversation in the breakout rooms. I invite you all to join the 3 breakout rooms, one on education facilitated by Susan Nicolai, one on health facilitated by Fiona Samuels, and one on income and wealth facilitated by Emma Saman. Please do join the breakout rooms and we'll pick up these conversations, including questions that are coming through from the audience in those sessions. A big thanks to our panelists.